So first thing we want to do in this position is just locate the fibula. You can feel the proximal fibular head, and the lateral malleolus is the distal head of the fibula. So anything in a straight line between those 2 points is a peroneal muscle. It's the only muscle sitting on top of the fibula. The proximal half or so is going to be our peroneus or fibularis longus. So I can press in against the bone, feel the belly of the muscle, and I can have her do a few things. She can plantar flex or push against me like a gas pedal. You can see the tendons stand up. You can see the belly here contract. That would work. I could also have her evert the foot, or I could invert it and have her try to bring it back to neutral. So you're trying to move it this way. Other way. There you go. That will fire it. Peroneus brevis, its little buddy, is just the distal half or so, a third to half. And it is deep. Peroneus longus is kind of tendony and running over it. So we're pressing through that part of longus against the fibula and then doing the same thing. Have her plantar flex, and you'll feel it contract. You can relax. You can also invert the foot and have her evert it against you. So you're going to move your foot this way. I'm going to hold it this way. Other direction. There we go. Good. And you can see it standing up. It's okay. If you're ever working with a patient and you need them to contract it, make the motion like that. Say, okay, I'm going to do this. You're going to do this. And that way they know, because they don't know the names either. Sometimes you can feel a separation between the tendons, but a lot of times you can't. They're just bound together, wrapping around. Down here, we may be able to feel the tendon of brevis as it comes across to the tuberosity of the fifth metatarsal. So I'm going to hold her foot and have her push down like the gas pedal, and then I'm going to strum right across, and sure enough, you can feel it on her right there. You can relax. For peroneus tertius, we're going to investigate this sinus tarsi, the little gap here in the ankle, the depression. And we're feeling for a tendon coming from here down like this towards the fifth metatarsal. So it would be running this way. So I'm going to try to strum across it in the opposite direction. The tertius doesn't have the same actions. It actually dorsiflexes the ankle. It does evert the foot, although it's weak and kind of useless. But moving it around, you just feel around and see. I don't believe she has a tertius. I don't feel any tendon in there. We could check her other ankle, but I'll let her partner do